Hello everyone, I am Dr. Sugata Mishra, Senior Consultant and IVF Specialist at Crysta IVF Kolkata. Today we are going to discuss on one of the most burning topic in the field of IVF, that is egg or oocyte freezing. In this modern era, a woman aims at achieving everything in her life, from a successful career to a complete happy family. Many of them do not wish to conceive till they are in their late 30s or even in their 40s, till they are actually ready for this beautiful responsibility. So what exactly is an egg freezing? Medically speaking, egg freezing is a medical method by which a woman can preserve her fertility so that it can be later used in future for conceiving a baby. In this method, we preserve the eggs or the oocytes of a female, and they can be later used for making a good embryo and getting a successful pregnancy. To explain the whole process in brief, when a woman wants to do an egg freezing, then from the second day of her cycle, we start hormonal injections or gonadotropin injections. They are daily given for a period of around 10 to 12 days. When her follicles are mature, then the eggs are harvested by a process of ovum pickup, which is done under general anesthesia. These unfertilized eggs are then freezed under liquid nitrogen. When this woman wants to conceive later in her life, then these unfertilized eggs are fertilized using her partner's sperm, and the embryo formed is later transferred into the woman's womb, and hence a successful and healthy pregnancy can be achieved. So who needs egg freezing? Egg freezing can be of two types. It can be a social egg freezing or it can be due to a medical indication. Social egg freezing is done for reasons like if a woman chooses to delay her pregnancy, like if she wants to focus on her education, on her career, or she just does not wishes to conceive in her early ages. Medical indication is like if a woman is suffering from some kind of cancer and is supposed to undergo a surgery or a chemo or a radiotherapy. In that case, she can go for an egg freezing prior to the procedure. Apart from that, if there is some health condition due to which she cannot conceive, like an organ failure or a medical disease, long-term disease, in such cases also egg freezing is a viable option. So how exactly an egg freezing helps a woman? So the problem is that when a woman's age advances, the number and the quality of egg reduces, and then the chance of chromosomal abnormality in the offspring can be very high. Thus, when a woman does egg freezing, she increases her chance to become a genetic parent to her child, and the chance of chromosomal abnormality in the offspring due to ovarian aneuploidy decreases. What is the best age to go for egg freezing? Well, the best age is somewhere between her late 20s to her early 30s, because that time the egg quantity and quality is the best. The risk associated with this procedure. So the risk is basically related to any ovum pickup procedure, that is the risk of ovarian hyperstimulation syndrome, fatigue, nausea, vomiting, abdominal pain, even breast tenderness. But if done with proper care and proper monitoring, all these risks can be easily avoided. And what can be an approximate cost of this procedure? Then it can range somewhere between 1,30,000 to 1,50,000. Hopefully, through this video, I could enlighten you something about the very important procedure called the egg freezing. Thank you.
वीडियो को लाइक, शेयर और चैनल को सब्सक्राइब कीजिए। हमारे फर्टिलिटी विशेषज्ञ से मुफ्त परामर्श के लिए नीचे दिए गए नंबर पर अभी कॉल कीजिए।